name's Dr. Mike Garfinkel. I'm a nephrologist, software developer, and the creator of docLogica, a point-of-care tool that can help you apply evidence-based diagnosis at the point of care. Today, I'm going to show you a few examples of how you can use docLogica to apply evidence at the bedside. First, let's imagine that we're in the emergency room and we're seeing a patient who we think might have heart failure. We want to know what questions we can ask on history that will best rule in or rule out this disease. What we'll do is press on test accuracies. We'll then search for heart failure. And we can then see the tests for heart failure that we can use. History results, labs, radiology, etc. We're interested in history, so we'll filter for that. We can see which test is the best to rule in or rule out. We can see that the absence of dyspnea on exertion is not a bad test. Here you can see the positive and negative likelihood ratios for the tests. In a nutshell, the higher the positive the positive likelihood ratio, the more a positive test result will increase the probability of the disease, and the lower the negative likelihood ratio, the more a negative test result will decrease the probability of disease. If we click on the test, we can see exactly how much the probability will change. Here we can see that a negative test result will take a 50% probability down to 32%. We can modify the pretest probability manually, or we can get suggestions from the literature. Here we can see that an elderly person presenting with acute trouble breathing will have about a 40% chance of having heart failure, and not having dyspnea on exertion on history will decrease that to 30%. docLogica has an extensive database of diagnostic test accuracies, more than 1,200 of them. docLogica also has a quite extensive database of pretest probabilities. If we click on the probabilities icon in the lower menu here, we can view some. Let's say we have a patient we're seeing in respirology clinic who was referred by their family doctor for chronic dyspnea. We want to know what the potential etiologies could be. We can click through the menus and then find those results. Here we see a listing of all potential etiologies arranged by probability with the reference at the end. docLogica also has quite an extensive database of disease characteristics. If we click on the symptoms icon, we can view some. Let's say we're seeing a patient with hypomagnesemia and we want to know what symptoms can happen with this disorder. We'll search for hypomagnesemia, and then we can see a nice point form listing of what diseases can what findings can happen in this disorder. Because docLogica has such an extensive list of diseases, about 1,800 of them, docLogica can also generate differential diagnoses. If we click on the DDX generator icon here, you'll see what I mean. Let's say we have a 72-year-old gentleman who presents with new onset diabetes and belching. We'll put in his symptoms here. We'll put in his age, sex, and let's say he's been having his symptoms for months. What happened here is docLogica found the subset of diseases within its database that fit those input parameters. It then arranged those possibilities by population incidence, as it also has incidence statistics. We can see that pancreatic cancer floats to the top. Let's click on this. We can see that the belching and diabetes are quite common symptoms in pancreatic cancer. We can also see the incidence statistics for pancreatic cancer. It floated to the top because this was an elderly gentleman, and pancreatic cancer is more common as we age and in those of male sex. We can also see what tests we can use for pancreatic cancer with their associated likelihood ratios. And we can read the Wikipedia article and look at the references for all this information. As you can see, docLogica is a powerful tool that you can use to better apply evidence-based diagnosis at the bedside.